since we just finished up the IEP and then the 504 series, so now we're going to move on to evaluations. So I've thought about this a couple different ways. If I'm thinking about in terms of advocacy, what's best for parents to know, things like that. I feel like it's better to know the evaluation components versus an IDA evaluation versus a 504 evaluation, because a lot of times they're going to be the similar things. So I'm going to talk about different components of an evaluation. So the first one's going to be getting that history. So the medical history, the educational history, things like that, and what does a parent really need to know, and what does a parent need to be looking for when advocating for their child and making sure that they get what they need. We'll start off with the education history. It's self-explanatory. It's gathering all of the records for the child. We're talking about grades, attendance. We're talking about getting their enrollment history, intervention history, anything that would be relevant to what the concern is and what we're looking at. So the purpose of why we need education history is if we're looking at things like specific learning disability, we want to know that we need to establish a pattern of struggling to meet those standards. And so that becomes really important. Just thinking about some recent cases from kids coming in from different districts, a lot of times that we'll get kids in that have historically performed pretty low when compared to other students their age. It's not okay for us to just say, okay, let's put them in intervention when all the data says that they might have a specific learning disability. Another reason why education history would be important is knowing how is it relevant to how the child is learning and functioning in the classroom. So if the enrollment history is they have 50 absences every year, pretty relevant. Also is an exclusionary factor. So we have to establish whether or not that attendance is a primary reason why the child is not making progress in the education environment. There should also be some state testing history, some district testing history. A lot of times STAR scores will be in that educational history as well. The medical developmental history. And a lot of times that section will come before the education history. I get a lot of questions about why are you asking, how the birth history was and how their birth had anything to do with what's going on in school right now and how their developmental history impacts them. I need to know all of that. And there's a lot of reasons why, because there's a lot of genetic markers. There's a lot of common history elements to students with disabilities. And I need to know if those are true of a child. So we usually go all the way through, was there any problems during pregnancy, during birth? Was there anything after birth? I want to know, like, a lot of times babies are born not breathing because they have the cord wrapped around them. All of those things are important in helping establish a medical history that's consistent with a disability. I really kind of harp on, did they have allergies and PE tubes? Speech problems? Did they struggle with meeting certain developmental milestones? Did they have head injuries as a child? Those things like that. So all of those would be relevant to temporal lobe, and it's a whole lot of psychobabble that ultimately it would affect and impact a way a child would learn. There's a lot of things like language process. A lot of memory is developed in that temporal lobe. So there's a lot of functions in that, and there's a lot of things that could impact how that functions and how that developed. So you're going to want to know medical diagnosis, medications. All of those are important. All that information, especially if we're looking at a mental, that's a disability related to like mental health concerns, like emotional disability or other health impairment due to ADHD, or anxiety or depression, things like that. That really impacts how much information I'm going to gather as an evaluator. And again, when you have a report, make sure you look at that developmental and medical history.